back now. Most experts in the healthcare sector agree that nursing is in a crisis. These professionals are often pushed to the limit with long hours and low salary packages. Last year's study by WITS shows that a third of nurses take up more than one job just to make ends meet. Let's talk more about this. Graham Anderson joins us from ProfMed, and Wendy Schleifer, who has been a nurse for a very, very long time, not a nurse anymore, but also with ProfMed. Good to have both of you. Welcome to the program.
Thank you.
Good morning.
Wendy, let's begin with you. You were a practicing nurse, and the ICU, I think it was Garden City, you were telling me, no longer practicing. What made you leave?
Well, first of all, Leanne, I mean the remuneration of nurses, be it in the private or the public sector, is inadequate. The working hours, I mean, for any person that's married and is married and has small children, the hours are long. You can't live a proper social life. Lack of resources in terms of whether it's fellow co-workers, colleagues, shortage of equipment, medicines in the hospital makes it a very difficult, unconducive environment.
Yeah,
and to have to take responsibility for a human being or a human life, and operate in an environment where it's unclean, it's not hygienic. You cannot. It takes the pride of nursing away.
Yeah, but you worked in a private hospital, however, as opposed to many of the public hospitals. Are you talking across the board?
No. I think the public hospitals predominantly need to really clean their act up in terms of cleanliness, hygiene, resources, be it human resources or equipment.
Yeah. And of course this reflects on how a nurse treats the patient.
Exactly. I mean, it's not conducive to having pride in what you do.
Yeah, which is a problem. Graham, celebrating Nurses Day, it was on Monday, it's International Nurses Day. I'm getting a feeling that there isn't too much to celebrate.
There's a massive shortage of nurses in this country, unfortunately, Leanne. We have, in South Africa, just over 460 nurses per 100,000 population, whereas a country like Australia has over 1,000 nurses per 100,000 population.
Yeah.
And unfortunately, I think that doesn't show the full picture, because the nurses that are registered in a country are not necessarily the nurses that are actually practicing nursing in that country. And as you spoke to Wendy just now, she's no longer at the bedside. She's still a registered nurse, but she's no longer at the bedside. She's now working for a medical scheme, or they work in doctors' consulting rooms, and many of them work abroad. So I think that the number of nurses, the human capital that we have in terms of nurses is quite dire.
Yeah. Are we finding that, I suppose, three scenarios? A, there are no nurses, or there are no students wanting to become nurses. B, nurses that are qualified are leaving the industry and finding other jobs like you are. And C, they're leaving the country to perhaps greener pastures. Are those the three reasons we have a shortage? Yes,
they are the reasons, and I think that there's another reason, and that is that early in the current government's regime, they closed all the nursing colleges. And for a long time we didn't have any nursing colleges, which slowed the pipeline or the feeding line of nurses into the system. Fortunately, that's been reversed, and last year they started opening them up. But that has a lag effect, because the nurses that are going into those colleges now, it takes 4 years before they start coming out at the other end of it.
So that is a long time.
I think that there are people that are still wanting to go into nursing. But I think that and the other issue, I think, is that they should be allowing the private sector to train nurses. Now, that hasn't been allowed up until now, or it's been very limited. And I think if they opened it up to the private sector to be able to train nurses, I think that would be another source of expanding that human capital.
Wendy, very quick, I've got to wrap, they're going to shout at me. Your wish for the sector, if you had to ask the health minister to improve something or a few things, what would they be?
To look at the working hours, look at the working conditions.
Remuneration, I know you mentioned.
Remuneration and recognition for the work that they do.
Yeah. I mean, that is unfortunately a reality, and I suppose many patients are quick to criticise, but I suppose nobody
That's a
really
problem.
knows what's going on behind
That's
the
a
scenes.
problem. You know, you hear all the bad stories of the caregivers, for example, that hit the old patients in the old age homes, but you never hear of the good stories and the good work that the nurses are doing, especially in the specialised units.
Yeah.
There's no gratification and there's no incentive.
We need to take this further, but unfortunately we've got to wrap to get to the news. Graham Anderson and Wendy Schleifer, who used to be a nurse, who's now working with ProfMed alongside Graham, thank you for being with us. Thanks for talking to us. Please write to us. Let us know, are you a nurse? Is this something that you're experiencing as well? What do you feel needs to be done to improve the nursing sector? It was International Nursing Day. Feels like there's not too much to celebrate, unfortunately. All right, let's take a quick